Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sunil Shedwe. He is a senior consultant transplant surgeon at Sagar Hospital at Jainagar as well as Banshankari. And he has many research papers to his credit. And especially the important one is the study of prevalence of human papilloma virus, which also causes the CS cervix, and whether it causes the cancer of urinary bladder. He has done the work. And welcome, Dr. Sunil.
Thank you, ma'am. Thank you for having me today.
Yeah, it's a pleasure having you. And there was a time, like years ago, decades ago, any person coming with the end stage liver, they used to say almost always alcoholic cirrhosis, alcoholic thing. And non-alcoholic used to be less. But now the alcoholic is also there and non-alcoholic have increased. What is the
Yes.
cause for that?
So as you said, ma'am, previously alcohol was one of the common cause of chronic liver disease or cirrhosis. Eventually, they will need liver transplant. Then equally important cause today is non-alcoholic fatty liver disease. Initially, it was described in people who are malnourished.
Hmm.
And then we also found that it is fairly common in patients who have obesity.
Hmm.
So nowadays, patients what we see who come for liver transplant, good number of patients are also because of long-standing fatty liver disease. So
Okay.
fatty liver disease is one of the leading cause of chronic liver disease in today's era. Apart from alcohol, hepatitis B and C are slowly disappearing.
Coming
And what
down
is the cause?
because of the vaccine. Vaccine is
Yeah.
given in an early stage and as soon as they are born. So that is
Yes.
coming down. Yes.
Hepatitis B is coming down, and we have good treatment for hepatitis C. So that is going behind. And now, fatty liver disease is one of the leading cause of cirrhosis. And how does fatty liver occur? It is because of one is malnourishment, which is kind of rare in today's era. It can happen, but then more common is obesity, and causes for obesity is sedentary life, not having a balanced diet, and then obviously alcohol and all these things contribute. Other thing, important thing contributes is diabetes, long-standing diabetes.
Okay.
So
Yeah.
yeah,
Many
nowadays the
diabetics
fatty
are
liver
common. Yeah.
disease. Yes, nowadays
And
fatty liver disease has been
all of them, they can be put into the metabolic syndrome,
metabolic
no?
syndrome.
Yeah.
Yes, ma'am.
Okay.
So now the name
Because
has been changed. The name, we don't call it medically, we don't call it as fatty liver. We call it as something called as MASLD, metabolic dysfunction associated steatotic liver disease, to represent that it is not only fatty liver but it involves multiple systems in the
multiple
body.
systems and organs in the body. Okay.
Yeah.
Okay. Okay. Now, what are the symptoms of this disease?
Unfortunately, ma'am, fatty liver disease doesn't cause any symptoms in an early stage. Only when the patient becomes chronic liver disease patient, and then once he starts having the symptoms of chronic liver disease or cirrhosis, and that's when you realize that patient had fatty liver disease for a very long time.
Oh,
But
okay.
nowadays, post-COVID, many people are doing regular health checkups.
Hmm.
And many of these health checkups, when they do, they get an ultrasound done, and in ultrasound, it is getting picked up that they have a fatty liver disease. And
Okay. So
increase awareness.
incidentally, it is picked up. Okay.
Yeah, yeah. And increase awareness about liver health. Many people are going and getting their liver tested.
Hmm.
Diabetics people know that they are at increased risk of having fatty liver disease, so they are all getting tests done, and it is getting picked up. Very,
Okay.
I don't say that
More
it's
often.
very,
More
it's,
often.
yeah,
Okay.
more often it is
Okay.
picked
Hmm.
because of
So they,
awareness.
yeah, the once upon a time they were getting investigations done to the heart because
Yes,
they
ma'am.
wanted to prevent the heart attack. But now, even to prevent the liver diseases, they are doing. Now, if
Yes.
there are no symptoms and ultrasound, is it very specific or you have something better than that?
So ultrasound is a first screening modality, ma'am. But
Hmm.
if there is fatty liver and it's if you want to do a good investigation, then you can get a fibroscan. Fibroscan will tell you grade of fatty liver, whether it is mild or severe. It will tell you how bad it is or it's mild. And then there are some patients, like we have patients who want liver transplant. There is a donor.
Hmm.
and family member who wants to donate and they have a fatty liver. In those cases, it becomes more important to quantify fat. In there, we do advanced tests like CT scan or MRI to actually see. Otherwise, for rest of the patient, ultrasound and a fibroscan is enough to tell us how bad is the fatty liver disease and to further follow.
Okay. Now, do you have any treatment for this?
So treatment of fatty liver is very simple, ma'am. So the most important thing is lifestyle and diet.
Hmm.
So what we tell people is you have to lose weight. Okay, we anyway between 5 to 10% of their body weight they have to lose, and loss of body weight has to be done by diet and exercise. And diet, a balanced diet, less carbohydrate, more protein, and regular exercise. With that, they have to lose weight, and fatty liver disease will come down. Nowadays, we also have medicines. If the first thing always is non-medical things, and if it not working, then we have newer medicines, semaglutide,
So
and
you
then
mean to say modification of lifestyle is first and then
first
the
yes.
medicines? Okay.
Yeah, and most important is prevention, if
Okay.
possible. Yeah.
So prevention is better than cure. Now,
Yes.
suppose they don't take care and then the fatty liver advances and the stage is severe, and then what happens? What are the complications of it?
So then they end up having a chronic liver disease, cirrhosis, and then they will have florid symptoms, portal hypertension, jaundice, ascites, renal dysfunction. And those patients will be candidates for liver transplant. So we should make sure that they, like nowadays, fatty, if you see, there's a recent study which has come from ICMR, 50% of the urban population is having fatty liver disease or
Oh my
MASH.
God, that's
And
enormous.
yeah, and if it is not treated, then good number of patients will eventually land up in chronic liver disease in next 20 to 30 years. There is going to
Oh
be
my
an
God.
epidemic of chronic liver disease because of this.
So
So it's
that
very
means
important to
people
control
like
it.
Dr. Shenvi will be very, very busy doing
No,
the
no,
liver
ma'am.
transplants.
No, we don't want we
No, no,
don't
I'm
want
just
people to get
joking.
sick.
I'm just
Yeah, yeah.
joking, you know. I
We
mean,
don't
you
want
don't
people to
wish
get
the
sick. Yeah.
people, but you are,
Yeah.
that's the reason you're talking to me to
Yes, ma'am.
bring awareness among the people, not to
Yes,
go
ma'am.
to that stage. Yeah.
Yeah, yeah, yeah.
Because at that time, you know, it is very difficult to save the person. So
Yes, ma'am.
extremely nice. So ultimately, what tips do you want to give to the our viewers?
So, for liver health, ma'am, people don't have to do anything extra. Anything which we advise people to maintain normal health, the same thing has to be done. Avoid alcohol,
Mm,
balanced diet,
mm,
regular exercise,
mm,
maintain your weight, and stay
mm.
away from any herbal medicines or any
Which
alternative
contain heavy
medicines.
metals and other things
Yeah.
which are toxic to the liver.
Yes, yes.
Okay.
So these simple
So,
things, nothing much people have to do.
okay.
If they have diabetes, then they have to control their diabetes very well
Diabetes, yes.
and do preventive health checkup so that we can pick up fatty liver early, we can pick up diabetes early, hypertension early. So do all those things. Regular preventive health checkup.
Yeah. Eat the balanced food cooked at home, do
Yes.
regular exercise, and see that you don't get into the trouble. So, avoid the
Yes.
metabolic syndrome. So, naturally, the fatty liver also will be prevented. So,
Yes.
thank you very much, Dr. Sunil, for giving so much of light. And if our viewers have any questions, Dr. Sunil will be very pleased and happy to answer your questions. Thank you.
Yes. Thank you very much. Thank you.